Welcome to the new employee orientation. Congratulations on your new job as a federal government employee. On behalf of the Blue Cross and Blue Shield Federal Employee Program, we want to thank you for choosing a job in public service. When you start a new job, learning about the different benefit programs available can be daunting. We are with you every step of the way so you can own your health. One of the best benefits of being a federal government employee is that you get a wide range of excellent insurance programs to choose from. Today, we'll help you learn more about these coverage options and how they might be beneficial to you and your family. Let's start by talking about your health insurance options. The Federal Employees Health Benefits Program, or FEHB, is a health insurance program administered by the U.S. Office of Personnel Management, or OPM, for federal employees, retirees and their family members. The FEHB offers the widest selection of health plans in the U.S. All FEHB plans provide coverage for medical services, such as doctor's visits, urgent care, hospital care, mental health care services, maternity care, prescription drug coverage and more. Here are some of the key features of the FEHB. The federal government pays a large portion of your premium, roughly 70%. You can continue your coverage into retirement. The federal government will continue to pay their portion after you retire as long as you've been an FEHB member for at least 5 years prior to retirement and meet eligibility requirements. You can take your coverage into retirement with you. Your portion of the premium comes out of your paycheck, pre-tax. You have no waiting periods for coverage. Your benefits begin as soon as your coverage is effective. For new hires, your coverage is effective the first day of the first full pay period after you enroll. Once you enroll, you can keep your coverage year after year without re-enrolling. If you want or need to make a change, you'll have the opportunity if you have a qualifying life event or during the annual open season period. There are currently over 100 plans in the FEHB. The ones that are available to you will depend on where you live and work. You can choose from a fee-for-service plan, health maintenance organization, consumer-driven health plan or high-deductible health plan. Fee-for-service plans are plans where your insurance company will either pay your provider directly or reimburse you for the cost of covered services when they receive a claim from you. Many of these plans provide nationwide coverage, and some provide worldwide coverage. A preferred provider organization, or PPO, is a type of fee-for-service plan. With a PPO plan you can see specialists without a referral, you have a contracted, or in-network, set of providers you can visit at a reduced cost, and you usually have little to no paperwork when you stay in-network. With these plans, a trade-off can be that you may pay more out of pocket if you go to a provider that is out of network. You may also need to submit paperwork when visiting providers out of network. Health maintenance organizations provide you with coverage within a specific region or work location. You get little to no paperwork, simplified costs, you'll pay mostly copays, plus many don't have deductibles, and a network of providers contracted with your HMO. With an HMO, you typically must select a primary care physician, or PCP, to provide your primary medical care. If you need to see a different provider or specialist, your PCP will need to provide you a referral before you can receive care. Keep in mind that in most cases you must stay within your HMO's network to receive care, unless it's an emergency situation. Consumer-driven health plans allow your health plan to put money away into a non-interest-bearing medical fund for you. You'll use these funds to pay your medical costs for the year. As long as you don't spend more than you have in your fund, all your health costs will be paid up front. However, if your healthcare costs exceed the amount you set aside in your fund, you'll pay high out-of-pocket costs for these services. High-deductible health plans allow you to put money into a health savings account, or HSA, or a health reimbursement arrangement, or HRA. This allows you to save for future medical expenses in a tax-advantaged way. However, these plans have high annual deductibles and out-of-pocket maximums. Your health plan will determine if you are eligible for an HSA. To see a list of eligibility requirements for an HSA, visit opm.gov/insure. If you're not eligible for an HSA, you'll be enrolled in an HRA. With an HSA, your health plan contributes to your account. You can make additional contributions on a pre-tax basis up to the allowed amount. Your funds earn interest. You can use the account to pay for any qualified medical expenses, and if you leave the government or retire, you can take your HSA funds with you. HRAs are similar to HSAs, however, your account doesn't earn interest. You can't take your funds with you if you switch plans or leave the federal government, and you can't make additional contributions to your account. Next, we'll talk about dental and vision insurance. The Federal Employees Dental and Vision Insurance Program, or FEHB, is a supplemental dental and vision benefits program coordinated by OPM. It includes separate health plans that provide dental or vision coverage for federal employees, retirees, retired uniformed service members, and eligible dependents. With FEHB, your premium comes out of your paycheck, pre-tax. Each FEHB plan has its own network of in-network providers. These are different from the providers in your medical plan. You don't need to be enrolled in a FEHB plan to enroll in a dental and/or vision plan. Your benefits begin as soon as your coverage is effective. For new hires, your coverage is effective the first day of the first full pay period after you enroll. Once you enroll, you can keep your coverage year after year without re-enrolling. If you want or need to make a change, you'll have the opportunity if you have a qualifying life event or during the annual open season period. You can take your coverage into retirement with you. Unlike FEHB, there isn't a 5-year enrollment requirement to keep your FEHB coverage into retirement. Your dental and vision coverage will always pay secondary to any medical insurance coverage you have. That means, if your health plan has dental and/or vision coverage included, it will pay first. Your dental and/or vision plan will pay their portion second. Let's start with dental. Federal employees can choose from up to 12 dental plans. Some of the plans are nationwide offerings, and some are restricted to certain regions. All FEHB dental plans cover basic services, such as cleanings and exams, intermediate services, such as fillings and extractions, and major services, such as crowns and root canals and orthodontic services. Some plans may have age restrictions and/or waiting periods for these services. Federal employees can choose from 5 nationwide vision plans. All FEHB vision plans cover routine eye exams and eyewear, including glasses and lenses, or contacts in lieu of glasses. Now that you know more about FEHB and FEHB, let's talk about how you enroll in coverage. We'll break this down by taking a closer look at the who, what, when, where, why, and how of your coverage options. You might be wondering, who can I cover? All FEHB and FEHB plans offer 3 levels of enrollment. Self-only. Coverage just for you. Self plus 1. Coverage for you and 1 eligible family member, such as your spouse or a child. Self and family. Coverage for you and multiple eligible family members, such as your spouse and children. The next step is understanding what you need from your insurance coverage. Answer the following questions about yourself. Who am I buying health coverage for? Just me? Me and my family? What benefits are most important to me and my family? Is it important that I am able to see my current doctors, hospitals, and other facilities? Do I want to be able to pick my own providers, or am I okay with my doctors telling me where to go for care? Here are a few more questions to consider. How important is it to know that I'm covered when I'm not at home? Of the medical plan types available, PPO, HMO, CDHP, and HDHP, which appeal to me? Do I need vision and/or dental coverage? How much am I willing to spend on my health coverage? Once you know what your needs are, you can research the plans available to see if they meet your needs. Don't hesitate to reach out to the different health insurers to ask questions and for more information. You can also talk to your HR department and your colleagues about their experiences with the different plans available. To see a full list of the plans available to you based on where you live, visit opm.gov/insure. There, you'll be able to put in your zip code or state and see all the different health plans in your location. You can also research dental and vision plans. Then, when can you enroll? You'll have 60 days from your entry on duty date, also known as your start date, to enroll. Please keep in mind that your coverage will not become effective until the first day of the pay period after your enrollment is processed. After your initial enrollment period, you can review your options each year during the annual open season period. This typically occurs the second Monday of November through the second Monday of December each year. You'll also be able to update your coverage if you have a qualifying life event. Examples of qualifying life events include the birth or adoption of a child, getting married or divorced, or specific changes in employment status. Now, where do you go to enroll? For FEHB coverage, you'll need to use your agency's preferred enrollment method to enroll in coverage. You can see a list of the systems here. If you prefer paper enrollment, non-USPS employees can fill out standard Form 2809 and submit it to their HR department. The form is available at opm.gov/insure. You should contact your HR department regarding any FEHB enrollment questions. For FEHB, you can sign up for dental and/or vision coverage at benefeds.com or by calling 1-877-888-3337. No matter what agency you work for. How do you enroll in the right plan? Each FEHB plan has a unique enrollment code. You'll need to select this code when you enroll. Make sure you choose the code for the correct level of coverage: self-only, self+1, or self and family. FEHB doesn't have enrollment codes. You'll just need to know the name of the insurance company you wish to enroll with and the level of coverage you need. Finally, why should you enroll? This is going to be unique to you. But remember, your health is important. Make sure to select coverage based on you and your dependents' healthcare needs. For the last part of this presentation, we'll talk about additional benefit programs you can consider. The Federal Flexible Spending Account Program, or FSA Feds, is a flexible spending account program, or FSA, for federal employees. An FSA is an account you can use to set aside dollars to pay for eligible healthcare expenses. The funds you contribute are not taxed. FSA Feds offers 3 different FSAs: Healthcare Flexible Spending Accounts, Limited Expense Healthcare Flexible Spending Accounts, and Dependent Care Flexible Spending Accounts. All 3 programs offer you the convenience of managing your account online or via the FSA Feds mobile app. As a new hire, you'll have 60 days from your start date to enroll in FSA Feds as long as it's prior to October 1st. After October 1st, you'll have the opportunity to enroll during the annual federal benefits open season. Unlike FEHB and FEHB coverage, you'll need to re-enroll in FSA Feds each year during open season if you want to keep your FSA into the following year. You also cannot take the account into retirement. You can learn more about this program at fsafeds.com. The Federal Employees Group Life Insurance Program, or FEHB, helps protect your family from financial burdens, such as funeral costs or loss of income, after you die. There are 4 levels of coverage: Basic, Option A, Option B, and Option C. Each provides a different amount of coverage and varies in premium cost. Most federal employees are eligible for life insurance. In addition, your spouse and eligible children under age 22 are eligible for Option C. As a new employee, you'll most likely be automatically enrolled in basic coverage. You'll have the option to buy up to a higher level of coverage or waive it if you don't want it. You have 60 days from your start date to make changes. After your initial enrollment period, you can cancel, reduce your coverage, or choose a new beneficiary at any time. If you wish to increase your coverage or enroll if you didn't enroll initially, you'll need to wait until the FEHB open season or have a qualifying life event. The FEHB open season is not the same as the annual federal benefits open season. It does not happen annually, it happens as announced by OPM. You can learn more about FEHB at opm.gov/life. Federal Long-Term Care Insurance Program, or FLTCIP, is the largest group long-term care insurance program in the world. It offers multiple plans to choose from. You can also create a customized plan. Long-term care insurance covers the cost of services you need if you can no longer complete everyday tasks by yourself due to illness, injury, or aging. It is different than short-term disability or health insurance. It's intended for chronic care that you may need for the rest of your life. This care may be performed at home or at a facility, such as an assisted living site or nursing home. Federal employees eligible for FEHB coverage are eligible for this program. You don't need to be enrolled in an FEHB plan to receive coverage. In addition, your spouse, parents, step-parents, parents-in-law, adult children and some domestic partners are eligible for coverage, even if you choose to forego it, as long as they apply while you're actively working. FLTCIP does not follow the same open season schedule as FEHB and FEHB. To apply, you can go online to ltcfeds.com or call 1-800-582-3337. In order to enroll, you'll need to complete a physical exam. Here are a few helpful resources to help you learn more. If you have any specific questions about the benefits and programs mentioned during this presentation, including how to enroll, you can reach out to your agency's HR representative or visit the Office of Personnel Management at opm.gov. To learn more about the Blue Cross and Blue Shield Federal Employee Program, visit fepblue.org or call our National Information Center at 1-800-411-BLUE. They're available weekdays, 8 a.m. to 8 p.m. Eastern Time. You can easily stay connected with the latest service benefit plan news and updates by following us at FEP Blue and signing up for our Blue News newsletter. Thank you for attending today's presentation, and congrats on your new job with the federal government. We hope you've found this presentation helpful.